talk to people from all walks of life, you hear the same story. Our current healthcare system is just not working. People may say it in different ways. I can't afford to buy health insurance for my employees. I can't find a doctor who will take my insurance. I avoid going to the doctor because of my high deductible. I got laid off and lost my coverage. A few years ago, the Universal Healthcare Foundation brought together business people, doctors and other health professionals, community leaders, clergy, union leaders, and healthcare advocates to come up with a solution. This diverse group of Connecticut residents worked with a team of national experts led by the Urban Institute to develop a smart new way to expand access to coverage, control costs, and improve the quality of healthcare. The result is a public policy proposal called SustiNet, a word in our state's motto that means sustains, because good health will sustain us as people and strengthen our state's economy.
SustiNet is a new approach to prevent illness and improve Connecticut's health.
SustiNet will be available to any Connecticut resident who needs affordable health care. People without health coverage and people with coverage that's too expensive or offers inadequate benefits can join.
It's open to people regardless of pre-existing conditions, and it stays with them through job changes, divorce, or changes in life. And businesses, nonprofits, and municipalities can choose to offer SustiNet to their employees. SustiNet offers a quality choice for everyone. No one is required to enroll. You can always choose to keep the insurance plan you have now.
SustiNet works by bringing together large numbers of Connecticut residents into a single group or pool of members.
It then uses the purchasing power of this large pool to negotiate fair payment rates for doctors and hospital care, as well as more affordable prescription drugs. This is exactly how most big private businesses like Pratt & Whitney and General Electric provide health care for their employees. SustiNet is overseen by an independent public-private board which puts the quality of care, better health outcomes, and cost controls first. This board monitors the success of the pool, makes recommendations for change, and reports to the state legislature.
Every member of SustiNet will have a regular source of coordinated care through one healthcare provider. This is called a medical home, the 21st century version of a family doctor. This drives down costs by improving how people with chronic diseases like diabetes, hypertension, and asthma are treated, and tracks overall health with an emphasis on prevention and early detection of problems. SustiNet also uses the latest technology to support each person's health care with a secure, statewide electronic medical record system. This allows more informed communication between doctors and patients and improves coordination among healthcare professionals.
SustiNet will not replace private healthcare coverage, but will stimulate competition. SustiNet will offer a new option for employers to consider, an option designed to reduce cost, improve quality, and deliver savings.
SustiNet simplifies a complicated healthcare system and replaces it with a rational system designed to pay for better health, not just the delivery of healthcare. It uses modern technologies for filing claims, investing in wellness, and providing fair payments for care.
Businesses that choose to join SustiNet will spend less than they do today to cover their employees. Those who can't afford to cover their employees in the current market will have the option to join SustiNet and pay for it through a modest payroll tax.
People who enroll in SustiNet will save an average of $875 a year in healthcare costs. People with higher out-of-pocket costs, such as huge deductibles and large co-pays, are likely to save more. SustiNet requires the state to invest $950 million in 2014. This investment by the state leads to $1.7 billion in saving for households and businesses and results in everyone having coverage. It also stimulates $800 million in federal funds for Connecticut. The bottom line is every dollar the state spends on SustiNet returns in $2.60 in savings and new funds.
Without SustiNet, healthcare costs will continue to rise faster than wages. This will leave more families and businesses unable to afford healthcare, and the number of people with poor coverage will increase.
Individuals and employers will pay for SustiNet just as they pay for healthcare now. Individuals will contribute based on their ability to pay, and small businesses will be protected from out-of-control costs.
Federal and state government will continue to pay as they do now to support subsidies needed to make healthcare affordable to low and moderate income people.
With SustiNet, we will all spend less, get more for our healthcare dollars, and rest assured that we will always have good care.
SustiNet will roll out in phases. In 2009 and 2010, the state will plan and prepare so that SustiNet will be ready to run efficiently and effectively. People without adequate healthcare coverage can start enrolling on January 1st, 2011. If SustiNet is adopted into law and will be entirely up and running on 2014.
Our healthcare system is failing too many people. It's on life support, and it's in danger of collapsing. SustiNet provides a better way to treat all patients, especially those with chronic illnesses, a major cause of poor health and overall healthcare expenses. The emphasis on a 21st century healthcare system will allow doctors to focus on best care rather than chasing paper. We owe it to the people of this state to focus on better health.
Businesses, especially small businesses, lose out every day that we delay fixing the healthcare system. Our current economic crisis only makes inaction worse. SustiNet provides us with the opportunity to stabilize business costs, attract and retain good employees, and have a healthier and more productive workforce. We owe it to our businesses and to this state to offer a better choice for our healthcare dollars.
Every day in Connecticut, people lose sleep over our broken healthcare system. Too many people lose their health, their homes, or their loved ones to a system that fails to meet our needs.
With SustiNet, Connecticut will lead the nation, demonstrating a smart, new way to expand access to coverage, control costs, and improve the quality of healthcare. SustiNet gives Connecticut healthcare we can all count on. It's smart, it's right, and it's time.